The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm glad that you've joined us today, and I'm also glad that Dr. Zeno Charles Marcel is with us. Welcome, Doctor.
Thank you. It's good to be here.
We're going to be talking today about a subject that really touches the lives of many Americans, that being heart disease. And heart disease, I believe, is the #1 killer in America. Is that right?
It is the #1 killer. That's correct.
But today you're probably saying, well, we've heard a lot about heart disease. Not today's program you haven't heard about, because we're going to be talking about heart disease and little-known factors that relate to heart disease. We're going to review some of the regular ones, but we're going to look at some little-known ones, and it'll be well worth your while to stay. Now, if you're watching today and you need to have information about how to get a hold of the Lifestyle Center of America, one of the best ways is over the internet at www.lifestylecenter, or is it lifestylecenter.org, or you can call us here at 3 Angels Broadcasting Network, and we can give you the contact information of the phone. But that's fairly easy to remember, Lifestyle Center. And you treat heart disease there as it relates to lifestyle, isn't that right?
That's correct. And we have the principle of working with first things first. So lifestyle is actually very important in preventing and in treating heart disease, particularly the atherosclerotic heart disease, which is the kind that is responsible for most of the death in this country.
So you're a doctor of internal medicine. That means you deal with a lot of patients that are very acute situations and ICU or intensive care or cardiac care units.
Yes, in the hospital setting.
Those types of things. But then you also do things that can help people avoid that. And a thing that's come up recently, probably within the last 40 years or so, has been this whole idea of risk factors. What is a risk factor, and what are the common risk factors for heart disease?
A risk factor is just some attribute that a person may have or may be in contact with that increases the person's likelihood of getting a disease or getting a condition. The typical risk factors that most people would already be familiar with for heart disease include things like cigarette smoking, lack of exercise, or what I call slothfulness, high cholesterol, some of their family history. So if they have a parent or a brother or sister who has premature heart disease, then they're at increased risk for having heart disease as well. Obesity, diabetes, high blood pressure. These are all typical risk factors that are...
How many risk factors do you know of? Someone told me there's over 20 now that they've identified.
Actually, there are over 20. Some of them are major risk factors and some are minor risk factors. And what I would like to do today is to talk a little bit about some of the less well-known but still very important risk factors.
Well, let's talk about those. What are some of the less known but very important risk factors?
Well, one of them is homocysteine. And that we can have 1 or 2 programs just talking about that. But homocysteine, high homocysteine levels in the blood, is a risk factor for heart disease. This was known around the same time that cholesterol was coming on the picture, on the screen, but cholesterol kind of eclipsed the homocysteine stuff, and that didn't re-emerge as a serious problem until just a few years ago. Nonetheless, homocysteine is an amino acid, or one of the building blocks of the proteins, that can build up in our blood, and it's associated with an increased risk of heart attacks and of strokes.
So what does it do? Your homocysteine's in your blood, it's cruising around, it's in this little car. What's it do? Does it slam into the wall, or break the windows? Does it has a sledgehammer in its hand? What's it do?
As far as we can tell, what it does is it irritates the lining of the blood vessel walls and penetrates the blood vessel wall to set up a reaction in there. And that reaction then is an atherosclerotic reaction, or it develops a plaque. And that plaque then can rupture and cause a stroke if it's one of the arteries in the neck or in the brain, or if it's in the heart, the arteries in the heart, then it could cause a heart attack.
So are there like foods that we eat that are high in homocysteine, or what is it that really causes it to elevate?
Well, there are some foods that are high in another amino acid that then leads to homocysteine being high, and those foods are foods that are high in the amino acid methionine. Now, methionine is found abundantly in foods of animal origin or flesh foods. So meats and milk and cheese and eggs, they tend to be higher in methionine than foods of plant-based. Now, but that's the methionine side. Mm-hmm. But there are some other factors, such as lack of some of the vitamins like vitamin B6, vitamin B12, and folic acid. If you don't have this in your diet, or it's not adequate in the diet, then that can lead to an accumulation of the homocysteine, which is produced by the methionine.
Okay, so let's talk about that a minute. The B12 then being something that many times we hear vegetarians don't get enough of, or those that are on plant-based foods. Does that mean that they're at more risk for their homocysteine going up?
Well, some people would be if they absolutely aren't getting vitamin B12, not from their diet, but not supplementing it either. Mm-hmm. Those people would be at increased risk of having high homocysteine levels. What people usually don't realize is that the body does not make vitamin B12. Animals don't make vitamin B12. We have to get vitamin B12 from something that we ingest. For people who eat meat, well, when they eat the meat, they get the vitamin B12 from the meat, or if they drink milk, then they get it that way. Mm-hmm. For people who are vegetarians, total vegetarians, that is, then the best way to get it is to supplement it in the diet using one of these little easily available supplements that will be dissolved in the mouth.
So like a B complex vitamin, or
actually I don't recommend using B complex
or something.
I don't recommend using the B complex vitamins because those are usually in pills that people swallow.
Okay.
B12, to be most effective, ought to be best dissolved in the mouth. And so there are B12 preparations, either as liquids, some as sprays, or some as just these little dots that you can crush. And the amount that you need is really very small, very little bit. It's 0.1 micrograms per day somebody needs, and that's a really small amount. One of the ways that I tell patients that they can take this is to get some B12 supplement, crush it, keep it in a little vial on the dining table on the kitchen counter, and once a day they just take a clean toothpick, stick it into this crushed tablet stuff. Whatever is stuck on the toothpick, that's about how much you need for the day, okay? And then, of course, you discard that toothpick.
What about these other,
the other vitamins?
Substitute milks and different things that have B12 in them?
If they have the B12 supplemented, then, of course, that's a way to get it as well.
Right. Now, just a question. I know this, and we're asking this because it relates to homocysteine. Because if you're low in that, then that elevates, like you've mentioned, I guess, in the bloodstream. But where do the animals get their vitamin B12?
They get the vitamin B12 from the bacteria that they have, or if it's a carnivorous animal, it will get it from animals that it eats. See?
Oh, okay. Just wondered where they got that. So homocysteine then needs to be low, and do you at the Lifestyle Center of America check for homocysteine?
We check just about every patient that comes through our center who is at risk for coronary artery disease or atherosclerosis. We check their homocysteine levels, which means most of the people who come there. We also have a good track record in terms of what happens even within 7 days of the homocysteines being lowered significantly in most of the people who come through just by changing their lifestyle to the way we do. And this was published in the Journal of the American Medical Association back in 1997.
Is that right?
Mm-hmm.
Okay, so if you're wanting to lower that homocysteine level, a Lifestyle Center of America or a program similar to that would be helpful. What are some other less known but very important risk factors for heart disease?
Another one that has emerged recently, it was kind of suspected maybe 10, 15 years ago, and more we see greater evidence of that, is infection by an organism called Chlamydia pneumoniae. Now, this is a bug that we can pick up in a variety of ways, the most important being through sexual transmission. This bug then sets up an inflammatory response, and the person's arteries then responding to this inflammation develops atherosclerosis.
So extramarital affairs of the heart are bad for the heart.
That's correct. Okay, if you put it that way.
Okay, so besides then the sexually transmitted diseases, which I think they're a very large problem in America. I know that when I worked in an emergency department as a nurse, we saw a lot of people with chlamydia. How big a problem is this, chlamydia, in America?
It's a fairly sizable problem. Most people who are working in the field realize that, you know, with herpes is probably the number one. Chlamydia is a close number two.
Now, chlamydia, then, what does it do? It gets into your heart?
It doesn't have to get into the heart necessarily, but it circulates in the blood. And its circulation in the blood somehow triggers the inflammatory response, so that the body reacting against the chlamydia, right, actually is what seems to stimulate the production of atherosclerotic plaque, or the hardening of the arteries. Now, we have been able to isolate chlamydia-type particles in atherosclerotic plaque, as well as finding other markers of inflammation, of the inflammatory response in the blood. And the higher these markers are for inflammation, oftentimes the higher the risk of heart disease.
So I'm sure, you know, the sexually transmitted diseases, of course, probably affect a lot of ages, but probably those that are young, that are just, you know, starting out thinking about those kind of things, they probably just don't understand that what they could do as a young person can be affecting their heart. They could develop heart disease from it.
That's correct. And my advice to any young person is the best way is the Bible way. That is, you stay away from sexual activity until the appropriate time, which is when you're married.
We have about 2 minutes, and you have another couple here. What are the other less known but important factors before we go to our break?
Well, one of the issues, and perhaps we could spend a great deal of time talking about this one, is stress. In the past, people knew about the type A personality and so on, and the fact that people who are under a lot of stress seemed to have more problems with coronary artery disease or atherosclerosis and heart attacks than others. This has been shown to be not quite as true as it was thought before.
So just because I get things done and I'm driven and all that doesn't mean I'm necessarily going to have heart disease.
That's correct. It doesn't mean that you're going to have heart disease.
So these
just because.
the CEOs, the Lee Iacocca types, or the others that were in charge of big corporations, are they usually in good health?
Well, some of them actually have very good health programs, in that they follow a very disciplined pattern. They exercise, they eat more appropriately. So you'd be surprised that the health of many of the executive types is that it's actually quite good, because these people are paying attention to what keeps them in tip-top shape, so that their minds can be clear, so they can be thinking and making critical decisions as best as they can. So everybody really should be thinking like a CEO.
You are in charge. You are the chief officer, executive officer of all those cells in your body, over the 1 billion neurons in your brain. You're important. Okay, so stress then is important, but it's more as it relates to different factors other than type A personality and whatnot.
That's correct. In '72, there were two researchers that came up with the type A issue. And that was found a few years later to not really pan out.
Okay.
And another group, the Western Collaborative Study Group, actually demonstrated that there's another set of factors within the set of individuals who have type A personality that actually might be the thing that produces the heart disease.
We're talking with Dr. Zeno Charles Marcel, and he has some other factors that are very important that he has not revealed to us concerning heart disease. They're very important, and so we hope that you join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who are able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. Zeno Charles Marcel from the Lifestyle Center of America there in beautiful Oklahoma, positioned right across that, on top of that beautiful mountain.
That's right.
And all those trees and different things. People just get healthy even seeing pictures of that sometimes.
So we're told.
And you get to live there and to minister there really and do that. We've been talking about heart disease, about risk factors that all of us know about heart disease, high blood pressure, obesity, diabetes, all these different kind of things. But then you start to identify some less known but very important risk factors, those being, what do we talk about?
We talked about chlamydia.
Chlamydia, homocysteine, inflammatory processes that are involved with that. And then we introduce stress. But there was something about stress that we kind of left at the segment here that's very important. What is that very important thing that we can't be involved with if we want to avoid heart disease?
Well, let me set the stage a little bit.
Okay.
Okay. Let's suppose the viewers at home. Let's suppose that you had a very important appointment, and you had to take a flight before you got to your appointment to get there in time. Now you schedule the flight so that you'll get there half an hour before. You had arranged for somebody to pick you up and take you to your important appointment. Okay.
Okay. I think I've been here before.
You've been there, right?
All right.
So everything is working all right. They call for people to enter the plane on time.
On time. This must be not like my normal carrier.
Everything is working out fine, except as you're getting on the plane, you realize that they're having a little scurry because someone who's supposed to be on the plane is running late.
Oh,
okay?
And they tell you that.
And you find out, you hear them talking. Okay? And when you see, here comes this person coming along with multiple packages, right?
Those for in the overhead bin underneath and underneath your bin.
I mean, much too much. Okay?
I've met this person.
Have you ever been that person?
I hate to say that. I think probably I have.
So here comes the person, okay? And the attendants and whatnot, they try to expedite the situation. You have gone on the plane, you're sitting down, okay? You know it's time for them to, close the doors, right? The person comes on the plane. They're not finding a seat. They're trying to stuff things up over the, in the overhead bins. They're trying to stuff things underneath, and things just aren't working out. Okay?
I have been in that flight.
All right. Now, how are you feeling as I'm talking about this?
I'm feeling a little anxious.
Okay, a little bit anxious.
A little bit frustrated.
All right. Finally, the person is sat down, maybe
and they
forcefully.
sit right next to you?
Maybe.
Oh!
And now the plane backs out. Right?
Okay.
You head down the runway, okay? And as you're taxiing out, you stop.
The plane broke.
The plane stopped. No, nothing broken. You wait. See, you're not hearing anything from the pilot. Nothing.
For 45
You look at your
minutes.
watch. Minutes are ticking by. You don't hear anything. And finally, the pilot comes on. And the pilot says something like this. Ladies and gentlemen, we're sorry to inform you, but because of our delay in pushing back from the terminal,
lost our slot.
We lost our slot. And it looks as though it's going to be about 15 minutes before we can get back into the queue. And you say? 15 minutes.
Yeah.
Plus, you already lost some time. How are you feeling?
Perfect peace have they. Of thy law, nothing shall offend them. But I'm not. That's what I'm looking at those texts right now. I'm claiming those promises.
Okay. So the flight takes off, and everything is working all right. The pilot says, "Look, it looks as though we have a tailwind. We're going to be getting there, actually on time. So what we lost, don't worry about it. We're going to get in there on time." How does that sound to you now?
Oh, I'm feeling much better.
Oh, relieved.
I'm
okay.
saying, why did I spend all that energy being upset?
All right. Now, if there's a difference between how you're feeling now and how you were feeling when we were talking about what was going on, the delays, okay, that highlights that there's a difference in what's going on physiologically on the inside of you. See, stress is not an external thing. Stress is actually an inside job. Now, what the researchers have been able to demonstrate is that this thing that's inside of us, okay,
That knot in the stomach.
that stuff, okay, is actually a greater predictor of your dying of a heart attack than all of the other risk factors combined.
Really? So the knot in the stomach, that feeling of frustration, all that, if that happens a lot, you are setting yourself up.
You're setting yourself up. You see, the issue is not just what we eat. It's actually what's eating us.
Oh.
The issue isn't just one of hardening of the arteries, but it's actually one of hardening of the heart. Because this thing that's inside of us, if I ask you, where does it come from? What would you say?
Got to be your mind.
Yeah, it's just generated in there. Now, we can learn how to take care of it in the sense of we can learn to change our behavior. In other words, we don't stomp up and down in the airplane, and if the person sits next to us, you know, we don't just turn our backs to the person. We might actually talk to them and try to calm down. So we might learn how to behave even though the situation may not be an optimal situation. But it doesn't negate the fact that this thing is on the inside. Okay?
Well, let me ask you a question. You are a Christian physician, so I assume you read the Bible and you believe in Christ.
That's correct.
Did Christ have that kind of anger when he saw the money changers in the temple and they were doing things in church they shouldn't have done?
I believe not. I believe what he had, this righteous indignation, was one that was mixed with compassion. Okay? He had compassion for the people who did not know that what they were doing was wrong. See, on the cross, one of the things that he said is, Father, forgive them. Now, he could have been very upset with what they were doing that was very unjust, okay? But he said, Father, forgive them. The issue with this thing that we have inside, it has been characterized scientifically as hostility. And there are three components to the hostility that is associated with atherosclerosis and hardening of the artery.
And if you have these, you know that you have the wrong kind of thing going on.
Yeah,
What are those three?
What are those three things? I know you couldn't get it out. Those three things are anger, actual rage, okay?
Right.
Aggression, that is when we act out. Okay?
All right. So you're going down the road, you get angry at that person, you swerve your car, and that's aggression.
That's aggression. And the third is cynicism.
Yeah. In other words, you get there and you say, well, I just had a great trip today.
Yeah. Or you don't believe, you're not believing that everything is going to go all right. Okay? You're cynical. Oh, this flight? No, this flight is not going to get there on time because it never has.
And if you have those elements, that's damaging your heart.
That's damaging your heart. That's correct. Now, the issue then becomes one of how do we change that? I don't know too many people that are really able to change their minds for themselves. Okay? Now, we say we change our minds all the time. That is, we tarry between two decisions and we choose one and then we choose another. Right? But to really change your heart on the inside, that's something that requires special care. See, we need a surgeon to do our heart surgery, right? And that surgeon is actually the Holy Spirit. He can change our hearts and take out our stony hearts and replace it with a heart of flesh. And then we're able to look at these situations not with anger and ire and frustration and aggression, but actually we're able to have peace that passes understanding.
You are a scientist.
Yes.
And I've changed the hats now. Just a couple minutes ago I said you're a Christian physician, and I asked you about that anger, but now I'm saying you're a scientist. Is there science behind what you just said? The Holy Spirit, forgiveness, those types of things?
Well, while there isn't science to state that we can prove the Holy Spirit by science and things like that, what we can say is that we have evidence of people whose lives are changed. Okay? We know that, for instance, part of the issue with the hostility and anger and aggression, it's associated with a characteristic that people have that is identifiable, scientifically provable, that is people who have a difficult time forgiving. Okay? Now, I have to ask, where does this desire to forgive, where does forgiveness come from? And scientifically, we can't prove where it comes from. All we know is that people either are able to forgive or they are not able to forgive. Now, we have to go to extra scientific resources to find out about this thing of the heart. And in the Bible account, we find out that forgiveness actually comes from God. As we are forgiven, as we understand that we are forgiven, it is much easier for us to forgive.
Do you see a lot of people in your practice there at the Lifestyle Center of America that really the issue is lack of forgiveness and this kind of anger?
I wouldn't say a lot, but a significant number.
And what do you do? What are the things you do? You're sitting across, I'm that person now. What would you say to me and why?
The thing is, you may come with the question and say, you know, here I am, I'm working out, I'm eating right, etc. How come I just had a heart attack? Okay? Now, the easy way to explain this is to start off with the fact that you have genetic predispositions as well to having heart disease. Okay? But after getting through that and we talk about, well, you know, genes and so on, you tell me, look, you know, my dad, he's 93 years old, no problem. My mom, she's 87, no problem. I have no one in my family who ever had heart disease. My cholesterol is normal. My homocysteine is normal. I have no C-reactive protein elevation in my blood. My chlamydia titer is very low. So what's the deal, right? And while you're sitting there you're talking to me, I can sense, okay? I can see that you have difficulty. Now, I can give you a test, a written test of 46 items that's a subset of the MMPI, or the Minnesota Multiphasic Personality Inventory. And how you respond on that test would tell me whether you have high hostility, whether it's primarily in the anger, aggression, or whether it's in the cynicism range. And if that is the case, then we'd have to deal with it. And the way we'll deal with it is I will have to ask you, are you willing to forgive this person or that situation? Because you will have stories of things that are really bothering you. That's how people are. They would have these things that they're carrying around. It might have been something that, you know, mom did when you were a little boy or something like that. And we don't have to get into all the psychoanalysis of those details. But what we need to do is to
we need to identify them. They need to be specific things, specific issues. You help them identify those perhaps and talk about them. Is it true, we got about less than a minute left, is it true that the situation, that is the other person that you talk about, may not change, but you can in fact change? That's
correct. You see, forgiveness is actually something that you can have that liberates you and liberates the other person as well. Forgiveness is really an act of love.
Thank you, Dr. Zeno Charles Marcel. We've been talking with the doctor about heart disease and things that really we don't usually talk about as related to heart disease. Today we've really focused in the last half of this program on anger. Are you angry? Are you struggling with something? Is there someone you need to forgive, or some situation, some person you need to forgive? We encourage you to do that. And do it now. If you need more information about how to do that, contact us here at 3ABN or the Lifestyle Center of America, and we hope that as a result you'll have health that lasts for a lifetime.